Thank you very much for your patience. And if we could put the guest up on the screen. Angeli, thank you. And again, we apologize. Well, I'm not going to apologize for them. They asked too many questions, so it's not my fault. But please, you go ahead, and then we'll turn it over to questions. Thank you.
Great. Thank you. Thank you very much. And it's always a pleasure to be with you all. As was mentioned earlier, I am here today to share with you the news related to our release today of the 2025 Global AIDS Update Report entitled AIDS, Crisis, and the Power to Transform. In this report with data, we show the latest progress, peril, and promise of the global AIDS response. In terms of progress, let me start by saying that the data that we share, the predominant data that we share in this report are from the end of December 2024, just before the sudden collapse in late January 2025. And what we see with the latest data by the end of 2024 is remarkable progress. Since 2010, new infections have been reduced by 40%. AIDS-related deaths have fallen by over 54%. 4.4 million children were protected from acquiring HIV since 2000. The report details one of the most successful public health responses in history, saving nearly 27 million lives and showing what's possible when the world comes together in solidarity. Right now, we show that 31.6 million people living with HIV, or 77% of all people living with HIV globally, are on life-saving treatment. This is extraordinary progress. And what we saw by the end of 2024 is that the end of AIDS as a public health threat by 2030 was indeed in sight. Let me shift and talk to you about the peril that we see and that we articulate in the report. There has been a sudden, abrupt wave of massive cuts and weakening of aid consensus from the single largest HIV donor, but also other governments all over the world since January 2025 and onwards. And what's happening is that it's putting the entire global HIV response in peril. All that progress that I just mentioned is at risk. We have modeled in this report and show that if the world does not act to mitigate and really ensure that there is continuity of support and resources for HIV prevention and treatment efforts, an additional 6 million HIV infections and an additional 4 million AIDS deaths will occur by 2029. What this means is that we will return to the late 1990s and early 2000s when the epidemic was at its deadliest peak. So the end of AIDS by 2030 with figures like that is simply impossible. This shattering impact is being made worse by a global backlash against rights, laws, and policies needed in wider society to end AIDS and sustain the progress over time. For the first time since UNAIDS began reporting, the number of countries criminalizing key populations had increased. Bans on same-sex relations are now in 64 countries and sex work in 168 countries. This dangerous trend limits access to HIV prevention and treatment services, and again, makes the progress of getting to end AIDS and get that response back on track even harder than before. We want to close, though, and we showcase this in the report, that there is indeed promise. We are seeing incredible promise and power to transform in the hardest of circumstances, the HIV response is adapting. Communities that are facing cuts are showing extreme resilience, and they are the bedrock of the HIV response. Governments in the global south are rising to the challenge. We are seeing that in 25 of the 60 low and middle income countries that were included in our report, these 25 countries have indicated that they are increasing their domestic budgets and their focus on self-sustaining their HIV responses in 2026. This is a promising sign. We're also seeing that there are new technologies that exist, new innovations that exist now that never had before. For example, we're seeing phenomenal new tools, a suite of long-acting HIV prevention medicines that are already coming to market with injections just twice a year that are nearly 100% effective at preventing and stopping HIV transmission from occurring. The HIV response was forged in crisis, and it was built to be resilient. We need and are calling for global solidarity once again to rebuild a nationally owned and led, sustainable and inclusive multi-sectoral HIV response. We're calling on all countries and communities to seize this opportunity through crisis, because the end of AIDS is in sight and we can get there, but it will require global solidarity. With that, I will stop and turn back over to you. Thank you.
Thank you so much,